And welcome back. SABC Radio Park is where we're coming from right now. And this is the SABC and the Department of Health and, of course, the Gauteng Provincial Department's pop-up center. It's a vaccine site. And, of course, you can come through, anybody in this vicinity. Or if you just like to take a drive and come and join us out here, you're more than welcome to do so. But we will also talk to things like vaccine hesitancy and acceptance and why it is that people feel the way they do about the vaccination process. Well, I'm with the Gauteng Premier David Makhura now. Mr. Premier, good morning. Thanks so much for joining us.
Good morning, Sakina and SABC viewers at home.
Mr. Premier, if I can just ask you to bring the mic closer to your mouth. You don't have to remove your mask. But of course, this is an exciting initiative. But talk to us about the importance of it.
Well, firstly, I would like to thank the SABC for this partnership. We're really going out there to find partners, civil society, various organizations and state institutions. We're also going to communities to get community organizations to ramp up this vaccination program, because in the end, vaccinating more and more people is the best we can do in fighting this pandemic. So I'm quite excited because this is a very well located site. We use these pop-up sites. We go where we know that people will be able to come. Firstly, SABC staffers here, but we have lots of students here in Auckland Park. There's several colleges here in the University of Johannesburg. So we look forward to an exciting day today. We need a lot of young people out, and they started on Friday coming out in large numbers. So I'm quite excited about this, and I take my hat off for the SABC. This is our public broadcaster. You have you're more than 2,000 workers here. We want them to vaccinate as well.
Absolutely. And of course, as you mentioned, we also have quite a few bus terminals right here, passing right by the SABC. So the convenience of it for people who maybe just can hop off a bus, come quickly get vaccinated and get back on.
Yes, and it doesn't take long. We tested this concept with Power FM last week, Friday. We got a lot of people there. It doesn't really take long. If we have more people, we increase the number of vaccinators. We even increase the number of, we've got these pop-up vans that come here. We can recall any van in places where they are not busy. So we're really looking forward. And my message basically to the people at home, if you have not taken your jab, either a J&J or your Pfizer jab, and if you are still calculating about it, if you're still asking yourself whether it's safe or not, I would like to say that the safest thing to do as we move now to December is just to make sure that you are counted amongst those who have taken their jab. In Gauteng province, we have administered 2.8 million vaccine doses so far, reaching 2.2 million people. Of those 2.2 million people, 1.2 million of them are fully vaccinated. Fully vaccinated means they have either taken the J&J or 2 doses of Pfizer. But we still have a mountain to climb. This is a densely populated province. We still there are 11 million adults in Gauteng. So we still have a long way to go. We must find these adults everywhere. At the SABC, we are going to campuses, we are going to communities, we are going to workplaces, and we are partnering also with the religious sector, with civil society groups, to make sure we take the vaccine where the people are. I also am happy that men are now responding. 2 weeks ago, it was a big issue. By yesterday, we saw our numbers have changed, have improved by close to 2%. In Gauteng, we are seeing, and it's driven by the millennials. The millennials are coming out in large numbers. I guess that's the new men.
Indeed.
It's like the new men, and I hope their response to the jab, this campaign, also should be going with another important campaign about against gender-based violence. That as they are responding so well to the message of vaccinating, I want to say to the young people who are responding so well, including the young men, we also have another responsibility to keep South Africa safe, to ensure that women are safe in our country and in our province, and the young men can lead that by example. So when we see women being killed, including young women in our campuses, today we are talking to the students in our campuses here. So yes, vaccinate, but also do other important the right things.
Absolutely. And Premier, that's such an important point because at this stage, the young people and the fact that they have come out in numbers is very inspirational. But of course, there are still some questions for those who are still hesitant that need to be answered. And what are we doing in terms of that as a government to ensure that the messaging reaches where it should, and that it actually addresses people's concerns that they may have around the vaccine?
Certainly, Sakina, we do also door-to-door work. We go into communities, we go into houses to talk to people. Last week, we did some work with the mayor of Johannesburg in Loli. We spoke to people. I was also in Ekurhuleni last week, Thursday, with the mayor of Ekurhuleni. We spoke to people there. We are able to get a sense that there are questions that need to be answered. So one of the questions is, are vaccines really safe? And this question needs to be answered again and again and again patiently. And we need to reassure people that we have evidence already in South Africa that vaccines are safe and vaccines save lives. We have seen it with the nurses, the healthcare workers, the doctors. A lot of our doctors who were vaccinated from February throughout May and June, by the time we hit that terrible third wave, those doctors and those nurses were all at work. Whereas in the earlier first wave, we had a lot of them themselves who were sick, who were admitted. We were running at half-mast with our staff. I encountered clinics where they were saying half of the nurses are actually either in isolation or are admitted in hospital. But we saw a big difference that vaccines helped to improve the protection. So we also need to assure people, when you have taken a vaccine, you might still get the virus, but your chances of getting the severe disease and getting hospitalized and even succumbing to COVID, your chances are drastically reduced. The second question that people the second question that they're asking about that makes them hesitant are the side effects. Even in my family, I have everybody would have experienced someone who has vaccinated who had side effects. Let me say that I am not a doctor, but I know that every medicine you take to treat an ailment, whether it's cancer or other medical drugs, all of them do have side effects. So I want to say to people, side effects are not a sign that it's not working. You have to make a choice. If you want to live, if you want to survive, you want to recover, the side effects will be there, but it's better to live and overcome those side effects. I'll give you an example about myself. I took my jab in July. I had some mild headache. I had some fatigue for 2 days. And that's the story. That's what the nurses said to me. You might experience some mild headache. You might experience some fatigue. And they said to me, just take paracetamol if you feel like that. I did that. I had young people in my family since Friday who vaccinated. One of them said to me, I'm feeling a bit tired. That includes my daughter who vaccinated also. I'm feeling a bit tired. I have some mild headache, including Citro in my office, mild headache. So you will experience some side effects, but those side effects in 2 or 3 days will go. I want to say those who have comorbidities need to disclose fully, because some of the cases of death may have to do with other underlying conditions. That's why they say to you, you need to tell the nurses what your full conditions are. And if you are not feeling well, you need to say, I'm not feeling well, and they will advise you what to do.
Indeed. Mr. Premier, we're going to park this conversation for now. I think very important issues that you raise about side effects that drives up hesitancy, and also as you spoke about, what the vaccine will actually do. It doesn't mean that you're not going to contract COVID. It simply means it reduces the chances of severe illness and hospitalization in the first instance. But we'll talk more to all of this. We wanted to speak to some of the people using the drive-through facility, but it was so fast. We just started and both cars were gone. We didn't even get to it. That's how quick it is. But I'll tell you what, we're still here for the duration of the morning, Leanne. So at this point, Premier of Gauteng, David Makhura, speaking to us. He seems to be well versed in terms of what is going on, what needs to be done, the messaging that needs to go out. But we'll talk more about it. And of course, no holy cows. If people come through, you want to talk about the questions you have around it, we're more than welcome to raise all of those issues as well. So from us here at the parking lot, the SABC pop-up site here at Auckland Park, at Radio Park parking lot, it's back to you in the studio, Leanne, and we'll catch up with you later.
Absolutely. All right. Thanks very much, Sakina. And certainly, I was watching those cars driving through and thinking how fast it was. So yeah, it's filling up. It was very, very quiet when we arrived this morning. Obviously, it was still dark, and there was just activity in terms of setting things up. But I can see from the visuals now that are coming through that that people that are arriving, they are having. There we go. We're getting to see one of the vaccines being administered now to somebody who is using the drive-through facility. You obviously come through, you show your ID, they tick you off on the system, put all your particulars through, drive through to the nurse who will then give you the vaccine. I do know that they make you wait just a little bit in terms of just making sure that you are fine, probably about 15 minutes. I'm sure they'll make you park your car and not drive off straight away, just so that you'll be able to see that there are no immediate side effects and that you are fine to carry on driving. And that goes for anybody, even in a vaccination centre. They'll make you just sit for 15 minutes just to make sure that everything is okay, and then you're on your way. The side effects, well, that's certainly something that we'll talk a little bit more of, but that's they warn you as well. I mean, you will get an SMS the next day and they tell you to look out for a bit of a fever, particularly a sore arm. That's also very, very common, but some people don't even get the sore arm, and all of these things to be discussed during this program. But we are asking you a question as well. It's well and good that we're all sitting and talking about getting the vaccine this morning, but we want to hear from people who don't want to have the vaccine and who are hesitant to have this vaccine. So we're putting out that question here on social media. Why are you hesitant to have the vaccine? What is it that is stopping you? So what are your reservations and what are your concerns? That's what we'd like to hear from you at Morning Live SABC, at Leanne Manners. Please do get hold of us and we'll read some of your comments and perhaps ask some of those that are gathering there, some of the health experts, to answer these questions for you. All right, that leads us up